cover tonight, and I don't want to keep you guys here too long. We'll just have to let people come in as they come in. So good evening. Hi, my name is Roma. I'm with the Area Agency on Aging and the Pikes Peak Area Council of Governments. And we are talking about Medicare. Tonight is part 2 of a 4-part Medicare 101 series. Hopefully all of you were able to attend last week's presentation, eligibility and enrollment. Tonight we're going to be talking about Medicare supplements, also known as Medigap, and Medicare Advantage plans. While we are going through the presentation, I will pause at the end of the different sections of the presentation to give you an opportunity to ask questions. You can ask questions in one of 2 ways. You can either type the question into the chat box, and I will address chat box questions at the end of each section, or you're welcome to unmute yourself when I pause for questions and simply ask your question through Zoom. We've got a lot of information to cover. Hopefully all of you received the email that I sent earlier today that included the slides for this presentation as well as the accompanying handouts. Hopefully everyone can hear me. If you are having any issues with hearing this presentation, please type into the chat box so that Jessica would be able to help you with getting that corrected. And I think that's all the housekeeping items I have. If I'm not talking loud enough, also please let me know and I can turn up the volume a bit. Otherwise, let's go ahead and get started. So again, tonight we are doing part 2 of the 4-part series, Medicare supplements and Medicare Advantage plans. We're going to start with, again, who we are. I'm with the Pikes Peak Area Agency on Aging, and the mission of the Area Agency on Aging is to remove barriers to independent living and to find and develop programs and systems for our region that help people stay in the community for as long as possible. The Pikes Peak Area Agency on Aging serves 3 counties in Colorado: El Paso, Park, and Teller. I am also with the SHIP program, which is the State Health Insurance Counseling Program. That is a federally funded nationwide program that's designed specifically to provide education and information on all things Medicare in an unbiased and free format. So we can help anybody who has any interest or concerns or questions about Medicare or anything related to Medicare. We can also help people who are on limited or low income apply for assistance programs to help pay for the costs of Medicare. This slide shows our toll-free statewide number and our local Colorado Springs office number. The SHIP program actually serves 9 counties in Colorado. So just a quick recap of last week's presentation where we talked about Medicare eligibility and enrollment and the primary parts of Medicare, Part A and Part B. We covered Medicare Part A is free for most of us. It covers all your inpatient facility stays, skilled facility stays, and medically necessary home health and hospice services. And we talked about Medicare Part B, which covers all of your outpatient services. You have to pay a premium for Part B, and there is some annual deductible and potential co-insurance that you would have to pay once Medicare pays their part first. Medicare Part A and B are considered your original Medicare benefits. So tonight we're going to talk about what options are available for people once they are enrolled in original Medicare A and B. And we're going to talk about the 2 primary options that are available on the open market, starting with Medicare supplements, also known as Medigap, or Medicare Advantage plans, sometimes referred to as Medicare Part C. Both of these options are available to anybody who enrolls in original A and B of Medicare. Both of these kinds of insurance options are regulated by Medicare, but there could be limited opportunities for you to enroll in any of these options. But we're going to talk about each one in detail. Starting with Medicare supplements, again, also known as Medigap. Medigap is the newer, more fandangled term used these days for this kind of coverage. So what is Medigap? Well, Medigap is a private insurance policy that you purchase from a private insurance company, and it is solely and specifically designed to supplement the cost that Medicare left over after Medicare Part A or Part B pays their part first, period. Let me say that again. Medicare supplement insurance is private insurance policy that you purchase from a private insurance company, and it is solely and specifically designed to pick up the balance that Medicare left over after Medicare Part A or Part B paid their parts first, period. They are federally regulated and state regulated and must follow federal and state laws. When you purchase a Medicare supplement insurance policy, that policy must say Medicare supplement insurance, those three words in that order. The term Medigap comes from the thought process that it covers the gaps in your original Medicare. And Medicare supplements are standardized into different levels of coverage. Those levels are labeled A through N like the alphabet, with a few exceptions in 3 states where they have a couple of additional levels of coverage to choose from. But the cost for Medicare supplement can vary by plan, by level of coverage, by the company you choose, by the zip code you live in. So there are a lot of factors that determine how much a supplement will cost, and we're going to talk about all of that. So Medicare supplements, or Medigaps, work with original Medicare. And again, they're designed to supplement original Medicare. So Medicare A and B would be your primary insurance. The supplement would be your secondary insurance. There are some situations where you would not need a Medicare supplement or Medigap. If you enroll in a Medicare Advantage plan, you would not enroll in a Medicare supplement or Medigap. When it comes to Medicare supplements and Medicare Advantage plans, you can have one or the other. You can't have both. If you have other credible coverage, such as TRICARE for Life, or you have the option of enrolling in a retirement benefit through an employer, such as PARA, or if you're a federal retiree or even a private employer, they may offer a health benefit for Medicare retirees that are specifically designed to work or coordinate with Medicare. And I always strongly encourage people who have a retirement option through a past employer to thoroughly explore that option to see if it is going to be a better option than what you could get on the quote unquote open market with a Medicare supplement or Medicare Advantage plans. Many times retirement benefits are enhanced and tend to have better benefits than what we're going to talk about tonight. With a Medigap or Medicare supplement, because it is secondary to your original Medicare, and Medicare is good anywhere in this country with any doctor, hospital, or provider that accepts it, Medicare, original Medicare, and a Medicare supplement can be the most portable health insurance option to choose because it's good anywhere in the country with anybody who accepts it. You don't have to worry about networks or referrals or prior authorizations when you have original Medicare A and B and a Medicare supplement. So who can get a Medicare supplement? Well, pretty much anybody. You do have to be enrolled in both Parts A and B of Medicare to enroll in a Medicare supplement or a Medicare Advantage plan. There are certain timeframes that are better to purchase a Medicare supplement than others. Primary timeframe that we're going to talk about is your guarantee issue period when you first become enrolled in Medicare. But you can buy a Medicare supplement at any time of the year for any reason. There is no annual enrollment period for supplements, as long as you can pass underwriting. And what that means is if you go to purchase a Medicare supplement and you are not in a guarantee issue period, the insurance company will be allowed to ask you health questions. And if they don't like the answers to those health questions, they would not have to sell you a Medicare supplement. Again, if you're in guarantee issue, which we'll talk about here in a sec, that's a different situation. But because there is no annual enrollment period for Medicare supplements, potentially you can purchase them at any time for any reason. In the state of Colorado, Colorado does require that people who are under age 65 and on Medicare, usually due to being on Social Security disability, are also allowed guarantee issue into a Medicare supplement when they first become eligible for Medicare. However, if you are under 65 when you are becoming eligible for Medicare and you're looking at purchasing a Medicare supplement during a guarantee issue period, you are probably going to pay a higher premium for that coverage simply because you are under 65. However, you would have a chance to change that coverage when you turn 65 and go into a lower priced plan at the same level of coverage because the price actually goes down when you turn 65. So there are times, as I mentioned, there are times that are better than others to purchase a Medicare supplement. Again, you can buy a supplement at any time for any reason, but you are subject to that underwriting where the insurance company will look at your health history. But the best time to buy a Medicare supplement is during what's called the guarantee issue period, sometimes also referred to as a supplement open enrollment period. The guarantee issue period is a 6-month window of opportunity from the time both Medicare A and B are in effect. So as soon as both A and B are in effect, you have a 6-month window that clock starts ticking on that 6-month window of guarantee issue. And what that means is you have a 6-month time frame to purchase a Medicare supplement from any company at any level of coverage with no questions asked. Meaning the insurance companies would be able to ask you health questions, but would not be able to turn you down for a policy based on the answers to those questions. Basically, you are guaranteed to purchase any supplement policy from any company as long as you do it within that first 6-month guarantee issue window. Once that 6-month clock starts ticking, though, you can't stop it. So again, as soon as your Medicare A and B go into effect, that 6-month clock starts ticking. Once it's expired, it's expired. And there are very few other opportunities that would provide you with an opportunity to have guarantee into a Medicare supplement where they would not underwrite. Other opportunities that might present itself, though, are called special enrollment periods. The bottom line is Medicare has put in place rules and regulations that would never put you in a position where you become uninsured or uninsurable through no fault of your own. It's called involuntary loss of coverage usually. So anytime you find yourself in a situation where you are involuntarily losing coverage, that usually creates an opportunity for you to be guaranteed issue into a Medicare supplement. That involuntary loss of coverage could include active employment coverage. You stop working, lose the employer coverage. Because you're losing that coverage involuntarily, it's not your decision, even though it's your decision to quit working probably. It is considered involuntary loss and it is loss of credible coverage. It provides guarantee issue. And basically that means if you decide to work past age 65 in Medicare eligibility, even if you enroll in Medicare at 65, but you continue to work and have employer coverage, when you stop working, that's when your 6-month window of guarantee issue would start. Instead of it starting when you first got Medicare, it would start when you lose other credible coverage. That can also include retirement coverage that you have to go with Medicare after you're retired. So if you are retired, you have been using employer coverage as a retirement benefit that's been coordinating with Medicare, and suddenly the employer decides to drop retirement health benefits for their retirees. Again, that would be at no fault of your own, and that would provide you a window of guarantee issue to enroll in a Medicare supplement to replace that retirement coverage. That can also include loss of COBRA. The most common way people can get a special enrollment period into a Medicare supplement would be by taking advantage of what they call test drive with a Medicare Advantage plan. I'm going to talk about that test drive and how that works and how that provides guarantee issue into a supplement when we get to Medicare Advantage plans. So we will discuss it in detail in a few. So again, Medicare supplements are designed to pay the balance that Medicare left over after Medicare pays first. What that really means is if you have original A and B of Medicare, you have a Medicare supplement, Medicare pays for an office visit, Medicare pays 80%. That 20% balance is picked up by the Medicare supplement. However, if you have an office visit and Medicare denies paying for that visit for some reason, your supplement will also deny paying for that visit. So a Medicare supplement only pays as long as Medicare pays. If Medicare does not pay for a service, the supplement will not pick it up. It only pays the balance after Medicare pays first. As with most things Medicare, there are some things that are not going to be covered by the Medicare supplement as well, because simply they're not covered by Medicare. So Medicare does not cover long-term care services, neither does the supplement. Medicare does not currently cover dental or vision, so neither does a supplement. Hearing aids, private duty nursing, outpatient prescription drugs, which of course would fall under Medicare Part D. Again, the bottom line is if it's not a benefit of Medicare or if it's something Medicare denies paying for, the supplement will also not pay their part. In the email that I sent earlier today, it did include a couple of handouts specific to Medicare supplements. One of the handouts is this chart, and this chart outlines the different levels of coverage you can choose to purchase as a Medicare supplement. Again, those levels of coverage are labeled A through N like the alphabet. And on this chart, it's going to tell you under each plan letter designation what benefits are paid after original Medicare pays their part first by the specific supplement plan level. I'm going to pause before I continue here to see if there are any questions so far. Again, if you have a question, you can simply unmute and ask your question, or you can always type it into the chat box. No questions? Okay, we will move on.
Wait, hold on just a second.
Okay.
Yeah, I see on that plan K and L, it says there's a max out-of-pocket. I'm not sure. Does that mean you can purchase a maximum out-of-pocket through the supplement?
No, what that means is, so let's talk about these plan levels a little bit and how the coverage works. So I'm just going to kind of go through the different plan levels here. As you look at this chart, you're going to notice that, again, across the top, it says plan A, B, C, D, F, G, K, L, M, and N. And I know it doesn't follow the alphabet exactly, and I'm not going to go into why. If you look at plan A specifically, for example, under plan A supplement, the only thing listed is basic benefits, which are described as the Part B coinsurance. Basically, after Medicare pays their 80% for a Part B service, an office visit or whatever, Plan A supplement would pay the other 20%. But that's the only benefit that Plan A supplement includes. You go on to Plan B supplement and it pays the 20% after Medicare pays first for your Part B services. And it also pays your inpatient Part A hospital deductible every time you're admitted. So Plan B covers those two benefits only. If we go to Plan C and D, it covers the 20% for Part B services after Medicare pays first. It covers the Part A inpatient hospital deductible every time you're admitted. It covers skilled nursing coinsurance. And if you remember from last week, skilled nursing is a Part A benefit. Medicare will pay 100% for the first 20 days of a skilled facility stay as long as you have a 3-day inpatient hospital stay or longer before you're admitted to a skilled facility. So 3 days in the hospital or longer, you're admitted to a skilled facility. Medicare pays 100% for the first 20 days of that facility stay. Starting at day 21, Medicare will continue to pay everything except for a daily coinsurance. This year, that daily coinsurance is $185.50 per day up to day 100. Plan C and higher covers that $185.50 per day. It covers that facility coinsurance at whatever amount that coinsurance goes up to from year to year. And that coinsurance does increase every year. But as long as you have a supplement with that benefit, it doesn't matter what that coinsurance increases from year to year to, that skilled facility benefit will always pay that amount. Plan C and D also have a what's titled as a foreign travel emergency benefit. Basically, Medicare does not leave the country. So if you ever travel outside of the United States of America and or our territories, you cannot take Medicare with you. It does not travel to other countries. Because Medicare doesn't travel to other countries, neither does your supplement. However, if your supplement policy includes a foreign travel emergency benefit, what that means is if you are in a foreign country and you have a medical emergency while you're in that country, basically you pay for that emergency while you're there. But when you get back home, you can submit that receipt to your supplement for reimbursement. So it's not actually a health benefit of your insurance, but it can potentially provide some reimbursement of the cost of a medical emergency while you're in a foreign country. You'll also notice that Plan C and Plan F are grayed out. And the only difference between Plan C and Plan D and Plan F and Plan G is the Part B deductible. Plan C and F include the Part B deductible coverage. Plan D and G do not. Because the reason the Plan C and the Plan F are grayed out is because anybody who becomes eligible for Medicare, not enrolled, but eligible for Medicare after January 1st of 2020 does not have the option of choosing to enroll in a Plan C or a Plan F. If you were Medicare eligible after January 1st of 2020, you cannot enroll in a Plan C or a Plan F. If your Medicare eligibility was prior to January 1st of 2020, you would have the ability to still choose a Plan C or a Plan F supplement. So for many people who are just becoming Medicare eligible this year or sometime last year, Plan C and Plan F are not an option for you. But if your Medicare eligibility was prior to that, you do still have the option of choosing Plan C or Plan F. But again, the only difference between those plans and their alternatives is the annual Part B deductible benefit. Plan F and Plan G also include what's called Part B excess coverage. Part B excess coverage is a benefit that pays a specific type of Medicare provider. And the way that basically works is when you have original Medicare as your primary insurance, there are basically two ways providers can take that insurance. Most providers take that insurance, original Medicare, on an assigned basis. And what that means is that provider accepts whatever amount Medicare assigns for the service that they're providing as payment in full. So for example, if you go to your primary doctor for just a regular office visit, And that doctor would charge you, if you didn't have insurance, that doctor would charge you $300 cash. But that doctor takes Medicare and takes Medicare assignment. So when you go for your office visit, that doctor is going to bill his retail price of $300 to Medicare. Medicare is going to turn around and assign $100 to that service. So that doctor may think his service is worth $300, but Medicare thinks it's worth $100. Medicare pays 80% of what they assign for services. The 20% balance would be covered under basic benefits of your supplement. Between the 80% Medicare pays and the 20% your supplement pays, that doctor is paid in full. Medicare pays that doctor directly. The supplement pays that doctor directly. You should not have to pay anything at the time of service. That doctor accepts Medicare assignment. The other kind of doctor does not take Medicare assignment, but it basically works the same way. You go to your doctor who does not take assignment. That doctor is going to bill Medicare $300 for an office visit. Medicare is still going to turn around and assign $100 for that visit and pay 80%. Supplement would pay the other 20%. However, because that doctor does not take assignment, that doctor would be allowed to charge you an extra 15% above and beyond what Medicare assigned for that service. And that doctor is usually going to charge you the whole amount up front. So when you walk into that unassigned doctor's office, they're going to ask you to pay $115 up front. They're still going to bill Medicare. They are required by federal law to bill Medicare. All providers are. But when Medicare gets that doctor's claim, that Medicare is going to notice that that doctor is not an assigned provider, and Medicare is going to assume that you've already paid that doctor up front. So when Medicare processes that claim, which they are still going to reduce to $100, they're going to send you a check for 80% or $80. They're going to send the rest of that claim over to your Medicare supplement. Medicare supplement's going to assume the same thing and send you a check for $20 or 20%. That extra 15% or $15 you paid up front, when you paid $115 at the time of service, is called Part B excess. If you have a supplement plan that includes Part B excess benefit, you would not only get reimbursed the 20% by your supplement, you'd also get reimbursed that extra 15% you paid that doctor up front. So that's basically how assignment works and what that benefit means. Any questions about any of that so far? Okay. Again, the only difference between Plan F and Plan G, which is the alternative for those who aren't able to get a Plan F, is the Part B deductible. Plan F includes it, Plan G does not. We start looking at Plans K and L, and you'll notice that the benefit that those plans pay are reduced to percentages. For example, if you look at the first benefit, Plan K pays 50% of Part B services. Plan L pays 75% after Medicare for Part B services. It only pays 50% of that $185 co-insurance for skilled rehab. Pays 50% or 75% for that Part A inpatient hospital deductible of $1,484. Because K and L plans do not pay 100% of what Medicare left over for those services, that's why they have out-of-pocket limits. What that means is if you have one of those plans, Medicare is going to pay their 80% or their part first. Your supplement is going to pay the balance at 50 or 75%. And because you have to pay the rest of that, what this is saying is that as soon as you have paid out of your pocket, after Medicare and your supplement have paid their part, you pay your part. And when your part out of pocket adds up to those limits, for a Plan K, $6,200, for a Plan L, $3,100, if you spend that much money out of your pocket after your insurances have paid their part, you will have reached the out-of-pocket maximum limit. and those plans would have to start paying at 100% for the rest of the year. That limit is applied on an annual basis. So you would have to have a heck of a lot of medical services within a year to reach those limits. On the other hand, because you are paying some out of pocket and these plans are not picking up the whole balance after Medicare, they can be significantly less expensive in premium. We move on to Plan M and N. Plan M and N are kind of hybrids. So Plan M pays 100% for your Part B services, pays 100% of the skilled rehab coinsurance, but it only pays 50% of your hospital deductible. Does include a foreign travel emergency benefit though. And then Plan N, which is becoming pretty popular, it pays 100% for your Part B services after Medicare pays first, except for any office visit you have or any emergency room visit you have. For an office visit, you would have to pay a $20 copay, and for an emergency room visit, you would have to pay a $50 copay. The supplement would pay any difference between those and what Medicare left over, and it would pay 100% of any Part B service balance for any other service that you might receive under Part B. Does pay 100% for skilled facility care, that daily coinsurance, and it does pay 100% for your Part A hospital deductible, and it has that foreign travel emergency benefit. Those are basically your options to choose from for coverage. And depending on how much coverage you want to have after Medicare is going to depend on the level you choose, and that is going to determine how much you pay for it. So I will pause to take a couple of questions in the chat box. Someone wants me to talk about TRICARE for Life and what it covers. So basically, TRICARE for Life is a benefit available to people who are retired from the military, meaning you've put in your 20 or more years in the military and have retired. It is only available to military retirees, and it is typically available to military retirees who are enrolled in Medicare at no cost. The closest comparison for TRICARE for Life would be to compare it to a Medicare Plan F, a supplement Plan F. It pays all your deductibles after Medicare A and B. It pays all your coinsurances for any A or B services. It has foreign travel. It pays excess charges. Basically, TRICARE for Life, an original A and B of Medicare, is probably the best coverage someone can have in this country today. And that's a good thing, because that's a benefit retirees have earned. So bottom line is, if you are Medicare and a military retiree with TRICARE for Life, you literally do not need any other coverage, period. Period. No drug coverage, because TRICARE for Life includes drug benefits. You don't need any other kind of coverage. You certainly don't need what we're talking about tonight, because you are Medicare and TRICARE for Life. So I hope that answers your questions. And then the next question I had real quick, based on what I've said so far, it looks like Plan G is the best or most comprehensive coverage. And should you assume that it's the most expensive? No. It is going to be considered the best level of coverage that someone who becomes eligible for Medicare after January 1st of 2020 can get. But that doesn't mean it is the most expensive, simply because insurance premiums for this kind of coverage are based basically on volume. The more people who enroll in a Plan G supplement, the less expensive it becomes. And Plan G is pretty popular right now, so it is not the most expensive option. It is pretty reasonably priced. And if you are just becoming eligible for Medicare at 65 or eligible for the first time, most of you will be in what's considered a preferred pricing tier when it comes to the prices of premiums. And so I can give you an average idea. A Plan G supplement right now for someone just turning 65 is probably going to run you about $120 on average. Some companies more, some companies less. And we'll talk about that, how you can get more information on that in just a sec. And then I had a question, is there a supplement calculator where you can try different scenarios? I'm not quite sure what kind of scenarios you would be looking at other than pricing the different levels of coverage with the different companies. And if that's what you're asking about, that's what we're going to talk about next. And if what I talk about next doesn't answer your question, please let me know. And then yes, TRICARE for Life does cover prescriptions. Absolutely. And it's considered better than Medicare drug coverage. All right. Looks like that's all the questions in the chat box. So we will move on. So basically this is your outlines of coverage. This is your levels of coverage to choose from. I typically suggest to people that you pick your level of coverage first. Pick the plan level that you would be comfortable having for the rest of your life, basically. Medicare supplements, again, do not have annual enrollment periods. So you do not get an annual opportunity to change this coverage. Once you're enrolled in a Medicare supplement, you are guaranteed that level of coverage for the rest of your life as long as you pay your premiums. But if you ever drop this coverage, you may not be able to get back into it. So it's basically a situation where once you're in, you're in. Once you're out, you could be out. So you want to be very comfortable with this coverage for the long haul. So pick the level of coverage you're going to be comfortable with for the long haul. Once you've decided on the level of coverage you're most comfortable with, then we're going to look at the next handout that I included in the email that I sent. This is the most current document that is provided to us by the state of Colorado, the Division of Insurance. This document is usually updated in midsummer, July. It was put out a little bit late last year, so it's going to be dated September of 2020, but it is the most current document available. And we would hope to get another updated document in July of this year. This handout, which is multi-page handout, is basically going to give you, in the first several pages of this handout, basically going to give you the same information I just covered. What is a Medigap or supplement? How does it work? When's the best time to get it, etc. About halfway through this document, you're going to start seeing these charts. These charts are going to give you an idea of what supplements cost based on age groups and based on the different plans that you have to choose from. So when we look at this chart, you're going to notice that in teeny tiny type or up at the top in the center, it's going to, well, it should say age 65. There was lost in translation there. So this page says age 65. If you flip to the next page, it's going to say age 70. And you flip to the next page, it's going to say age 75. When you're looking at these pages, you're going to notice along the left-hand column that it's going to list the insurance companies in alphabetical order, front to back of each page. There are at least 40 companies licensed to sell Medicare supplements in the state of Colorado alone. And we've listed all of them, front to back, alphabetical order. Across the top of this page, you're going to see A through N, just like the chart we were just looking at. And if you intersect a plan level, such as Plan G, if we go to Plan G and go down the column, if we intersect Plan G with, say, Humana Insurance Company supplement, if there is a number in the box where those two meet, that number does represent an approximate monthly premium for that plan with that company. But you'll notice as you go down this column that that number can vary significantly from one company to another. Some companies charge much more for a Plan G than other companies. Does that make the more expensive companies better? No. Does it make the less expensive companies worse? No. When you're looking at Medicare supplements and you're starting to shop around, what you need to keep in mind is that a Plan G is a Plan G is a Plan G, no matter who you buy it from. They're all selling you the exact same Plan G. Companies cannot add to, subtract from, or alter in any way these plans. So they're all selling you the same product. A Plan F is a Plan F is a Plan F. A Plan N is a Plan N is a Plan N. Doesn't matter who you buy it from or what you're paying for it, you're getting the same coverage. But because prices can vary from company to company, it does pay to shop around. And just because one company, such as Humana, wants to price the Plan G at $200 a month, while another company, such as AARP United, can price it as low as $120 a month, does not mean one company is better than the other, does not mean the coverage is going to be better than another. It simply means that that company has decided, based on whatever convoluted formula they use, that that's what they're going to charge for that plan in this area. Two things I want you to keep in mind when you're looking at this document, though. These prices aren't exact. They're estimates. They're in the ballpark. This handout is not designed to give you exact price quotes. It is designed to show you the approximate price differences from one company to another. Now, these prices are going to be in the ballpark. They're going to be close to what you would pay with these companies, but it's not an exact quote of what you're going to pay with these companies. To get exact quotes, you would have to call the company directly. It is going to show you what companies charge more and what companies charge less. Again, you're not getting better or lesser coverage if you go with a more expensive or less expensive company. Whether you've heard of any of these companies or not, they are all vetted by the Division of Insurance, and they are all going to give you the same service. I have not had any complaints or any issues of having to call about claims not being paid or whatever with any of these companies in over 15 years. So they're all good companies. They've all been approved by the Division of Insurance to sell coverage in Colorado. So the bottom line is it pays to shop around, and it pays to find a company that's going to save you money now, and hopefully that savings will continue in the future, because the premium for these plans and this kind of coverage, excuse me, does increase every year, just like the premiums for any kind of insurance, whether it's home, auto, health. Insurance is insurance, and premiums do tend to increase on an annual basis in some form or fashion. So again, this is going to be a tool that helps you determine what companies you may actually want to contact. It's going to help you narrow down that 40 company list to a handful of companies you might actually want to talk to and get some actual price quotes from. Whether you do that by calling the company directly and their 800 number is listed, or whether you do that by finding a broker or an agent, doesn't matter. Price is the same no matter which way you choose to enroll in a plan with a particular company. And if you can get an exact price quote by calling the company directly over the phone, all the better. A broker, on the other hand, would be able to do all of that legwork for you, because a broker will typically represent multiple companies and be able to shop around the companies that they sell for you and just present you with the end result, which is the price quotes. And an agent would be dedicated to one company, selling you one company's plans, and be able to give you information about that one company. Again, regardless of how you get that information or how you choose to enroll in a specific plan with a specific company, your price is the same. So I will pause and take some questions here real quick. So I said to maintain plan for life. So do you have to keep the same Medigap company then? So again, the bottom line is, once you're enrolled in a Medicare supplement, any plan with any company, once you're in, you're in. If for any reason down the road you will decide you want to go to a different company or even a different level of coverage within the same company, you are subject to underwriting. And again, what that means is that company that you're trying to apply to or make that level of coverage change with is allowed to ask you health questions. And if they do not like the answers to those questions, they do not have to sell you that coverage. They do not have to let you change your level of coverage. They don't have to sell you a new policy if they don't like your health answers. So basically, if you're healthy and they like your answers, you can switch to a different company as often as you like, because those companies will be happy to take you because you're healthy. Once you develop health situation or health issues that make you less healthy for an insurance company to take, the harder it would be for you to make that switch. So the less healthy you are, the more likely you wouldn't be able to make a insurance change with this kind of coverage. I hope that answers that question. But as long as you're healthy, if you wanted to switch to a different company, different plan, whatever, every month of the year, they'd be happy to let you do that because you're going to be healthy enough for them to want to insure. Next question, live in Trinidad and have been told that Humana is your only option in that area. False. Humana may be the only Advantage plan available in your area. As far as supplements, the supplement plans are available statewide. So any company listed on this handout, you have the ability to purchase a supplement from. And that supplement would cover you in the same way, no matter where you are or who you're seeing. Anybody who's told you Humana is your only option is telling you that Humana is your only Advantage plan option. And we're going to talk about Advantage plans next. Next question, do some companies use nurse practitioners versus MDs? That is kind of irrelevant. Medicare, again, original Medicare A and B is your primary insurance. As long as you can go to a provider of any kind that accepts Medicare A and B, bills Medicare A and B, and Medicare A and B will pay for, you can go to that provider. As long as Medicare pays their part for any provider or any service that you ever have, a supplement would pay the balance, period. So supplements have no say in that. It's all based on and determined by what Medicare does and does not do. So supplements, again, have no say. That also means that if you go to a doctor or a provider, as long as that doctor or provider accepts Medicare, your original Medicare is your primary insurance, they cannot say they will not take your supplement. They cannot say, I will take Medicare, but I won't take your Humana supplement, or I won't take your AARP supplement. They can't do that. Because Medicare paid first, they have to accept whatever supplement you have, as long as it's a standardized supplement, as listed here. They have to accept whatever supplement you have and take payment from that supplement after Medicare pays first. So they cannot say they'll take one but not the other. Next question is, do I have to shop every year then? And am I automatically accepted on the plan level I originally signed up for? Again, once you're in with a company at the plan level you choose, that's your coverage. There is no shopping around every year. There is no annual enrollment or open enrollment with this kind of coverage. Once you're in, you're in. Once you're out, you could be out. So as long as you enroll in this plan, any of these plans with any of these companies, when you first become eligible and you pay your premiums, your coverage will stay the same based on the plan that you choose for as long as you have that policy, meaning for as long as you pay those premiums. Next question, have you heard of any companies raising prices higher down the road once you've already signed up? For example, it seems like AARP coverage is cheaper up front, but is there a specific amount they are allowed to raise premiums per year? Okay, so premiums have to be approved. Any premium increase any insurance company has to be approved by the Division of Insurance each year. Most of the time, the Division of Insurance is going to approve in premium increases. What you want to look for when you're doing your shopping around is if you have the opportunity to ask a customer service rep or an agent or a broker, ask those people, can you tell me what kind of premium increases this company has had for this plan in the last 5 years? The average monthly premium increase is 6 to 15% with any company. And that's going to be 6 to 15% of the monthly premium per year. So AARP, I can tell you, tends to have more consistent premium increases, meaning they will consistently have the lower end of that premium increase scale on an annual basis. Other companies may have, a slightly higher premium increase one year, another high premium increase the next year, and then third year, they may not have a premium increase. So they're going to be a little less consistent. But again, if you can ask whoever you're talking to about that insurance, ask them, can you tell me what the premium increases have been for the last 5 years? And that might give you an idea of how consistent that company is with their premium increases. Otherwise, the only way you'd be able to find that information would be to call the Division of Insurance and ask them directly, because they do keep track of that. And let me make sure. So last question is, does PARA offer supplements as well as Advantage plans? And the answer to that is yes. And we will be talking about other insurance options that can coordinate with Medicare or work with Medicare, such as retiree plans on part 4. So I don't want to go too much into that. But yes, PARA does offer, well, no, that's not true. They offer Advantage plan options, but one of those options works very much like a supplement, which is why we're not going to cover it tonight, but I'm happy to cover it on part 4. Any other questions before we move on? I know we're running a little bit behind and we still got to talk about Medicare Advantage plans. So if there are no other questions, we're going to go ahead and move on. All right, so now we're going to talk about Medicare Advantage plans. This is basically the other option that you have on the private market for coverage to work with your original Medicare A and B. However, Medicare Advantage plans are an entirely different animal. They're an entirely different kind of insurance for Medicare. They work entirely differently. They cost an entirely different way. When you enroll in a Medicare Advantage plan, basically what happens is you are enrolling in a private insurance plan that has contracted directly with Medicare to act as Medicare for them. So basically, if you enroll in an Advantage plan, what you're enrolling in is a plan that's going to become your Medicare. And Medicare is going to pay them to act as that benefit for you. When you enroll in a Medicare Advantage plan, you still have original Medicare. You don't throw away your red, white, and blue card. Original A and B of Medicare are always there in the background. You can't enroll in an Advantage plan unless you have A and B of Medicare, original Medicare. But once you enroll in that Advantage plan replaces as your original Medicare, as the primary payer. But it is still considered your Medicare. So you still have all your rights and protections of original Medicare. You're still going to get all your regularly covered services of Medicare. Advantage plans are called Advantage plans for a reason, though, and they may include some extra benefits that are of an advantage above and beyond original Medicare. Common extras that used to be included, some additional vision services that are not covered by original Medicare, some hearing services, dental services, free gym membership was a big thing for a long time. And most of the time, Medicare Advantage plans will include a drug benefit, a Part D benefit. Unlike Medicare and a Medicare supplement, when you have original A and B of Medicare and a Medicare supplement, none of that includes drug benefits. You would have to buy a Part D in addition to your Medicare and your supplement in order to have drug coverage. Medicare Advantage plans tend to include drug coverage at no extra cost. There are some additional eligibility requirements to enroll in an Advantage plan, though. Primarily, you have to live in the plan's service area. So Medicare Advantage plans, as the question, the person who asked the question about living in Trinidad and being told Humana was the only option out there. Different counties, and basically your county is going to be your service area, or your network area is going to be your county of residence. Every county is going to have different Advantage plan options to choose from, or one option to choose from, or no options to choose from. Not every county in Colorado has the option of enrolling in an Advantage plan because the Advantage plan simply chose not to go to those counties. So you must live in a service area or a county of residence where the plans are available, and you must enroll in a plan available in your county. Again, you must be enrolled in A and B of Medicare to enroll in an Advantage plan. And you have to enroll initially during an eligibility period, which is what we're going to talk about as we go. Eligibility periods with Advantage plans and Part D plans as well. There are multiple enrollment periods to look at. The initial enrollment period is going to be the same initial enrollment period timeframe as when you enrolled in originally in A and B of Medicare. So that initial enrollment period is typically going to surround your 65th birthday or your month of eligibility, the 3 months prior to, the month of, and the 3 months after, keeping in mind that nothing can go into effect any sooner than the month of your birthday or month of eligibility. But Advantage plans and Part D plans have additional enrollment periods. There's the annual election period, what we typically call open enrollment every year. There's the new Medicare Advantage plan open enrollment period that's just for Advantage plans. And then there are always special enrollment periods or special enrollment opportunities for people who fall under situations of, for example, involuntary loss of coverage. Excuse me. The annual election period or annual open enrollment, that is the open enrollment period that happens every fall between October 15th, December 7th. During this time frame, you have the opportunity to get into, get out of, or switch from one to another Advantage plan or prescription Part D plan. Any changes, enrollments, or disenrollments you choose during that time frame go into effect January 1st. The new Medicare Advantage open enrollment period, again, is specifically for people in Advantage plans. It started a couple years ago. That enrollment period runs January 1st through March 31st. And the way it works is if you are in an Advantage plan as of January 1st each year, you have this additional 3-month window to either switch to a different Advantage plan or to drop Advantage plans altogether. So it's kind of a second opportunity to switch your Advantage plan, or it gives you a second chance to drop your Advantage plan. Any changes you make during this time frame, January 1st to March 31st, would go into effect the first day of the next month. If you choose to drop an Advantage plan during this time frame, you would automatically revert back to original Medicare A and B of as your primary medical insurance. And you would have the opportunity to enroll in a separate standalone Part D drug plan. Because most Advantage plans include drug coverage. If you drop your Advantage plan, excuse me, You would lose that drug coverage, so you would also be able to enroll in a Part D. If you are not in an Advantage plan as of January 1st, this enrollment period does not apply to you. It does not allow you to enroll in an Advantage plan if you're not already in one. Special enrollment periods, again, are going to be based primarily on losing coverage somehow. The most common way that would happen with Advantage plans is if you move. Again, because you have to buy an Advantage plan that's available to purchase in the county you live in. If you move from that county to another county or another state, you can't take that plan with you. It's only available for people in that county. So if you move from El Paso County to Pueblo County, you can't take your plan with you. Because you can't take it with you, it's considered involuntary loss of coverage, and you would be able to purchase when you get to the county you move to, either another Advantage plan that's available in that county, or it would actually give you an opportunity to be able to have guarantee issue into a supplement based on involuntary loss of coverage. Another way that might happen is if you are in an Advantage plan and from 1 year to the next, that Advantage plan decides it doesn't want to be in that county you live in anymore. Again, it pulls out. It's not your fault. It's considered involuntary loss of coverage. And because it's involuntary loss of coverage, you would be given the opportunity to either enroll in another Advantage plan that is available in your county, or it would give you an opportunity to have guarantee issue into a Medicare supplement. I told you we would talk about the test drive as we went on. The test drive is probably the third most common reason somebody would have a special enrollment period. What the test drive is basically an opportunity to try an Advantage plan. So there's two ways you can test drive Advantage plans without being totally committed to them or losing any opportunity to purchase a supplement with guarantee issue. The first way you can try and use the test drive for an Advantage plan, and again, this gives you an opportunity to try the Advantage plan out to see if it's going to be the kind of coverage that works for you for the long haul or not, without really losing your opportunity to be guaranteed issue into a supplement if ultimately you decide that's going to be your better option. The first way you can take advantage of that test drive is if when you first become eligible for Medicare, you go right into an Advantage plan. And if you enroll in an Advantage plan when you first get Medicare, you would be allowed to be in that Advantage plan or test drive that Advantage plan for up to 12 months. And when I say up to, what I mean is up to 364 days. If you decide at any time within that 364 days from the time you enrolled that that's really not going to be the kind of insurance that's going to be for you and you'd rather have a supplement, you would still have guarantee issue into a supplement because you're going to use your test drive. It hasn't been 365 days. So it basically can kind of extend that 6-month window of guarantee issue that you get initially when you first get Medicare. You get that 6-month window of guarantee issue into a supplement. It can kind of extend that guarantee issue for another 6 months almost. However, you would have to get out of that Advantage plan before 365 days elapsed in order to take advantage of that test drive. If you're still in that Advantage plan on day 365, your test drive has expired and you would not be able to get out with guarantee issue into a supplement. The other way you can use the test drive is if when you first enroll in Medicare, you go straight into a Medicare supplement insurance and you maintain a Medicare supplement insurance for a year, 10 years, doesn't matter. As long as you maintain coverage in a supplement without any break in that coverage, at any time in the future during an open enrollment period or an annual fall enrollment period, you would be allowed to drop your supplement, enroll in a Medicare Advantage plan, and test drive that Advantage plan, again, for up to 364 days to see if you prefer that over supplement. If at any time during that 364-day period you decide, nope, this is not for me, I want my supplement back, you'd be guaranteed back into the supplement you dropped. Not any supplement, but the supplement that you dropped. So it's two different ways you can take advantage of the test drive and try an Advantage plan out without being fully committed or without losing guarantee issue completely into a Medicare supplement. The test drive is only available to people 65 and older. It is not available to people who are on Medicare under 65, unfortunately. So I'll answer a couple of quick questions. Are there underwriting issues for switching Advantage plans like there are with Medigap? No. Medicare Advantage plans cannot underwrite. They cannot ask health questions. They don't ask health questions, except maybe, well, they used to ask if you had kidney failure, but they probably won't even ask that question anymore because that rule changed. So no, you can never be turned down for a Medicare Advantage plan, regardless of health. So it doesn't matter if you're healthy or not healthy. You are able to switch to any Advantage plan or enroll in any Advantage plan of your choice during any enrollment period without question. And there are some people who do switch to a different Advantage plan every year during open enrollment. Next question is, so if I move from Trinidad when I'm 70, would there be underwriting if I want to switch from Humana to another Advantage plan? Again, no. There is no underwriting whatsoever when it comes to enrolling in an Advantage plan. Must you get services in the area you enrolled in? For example, if you enroll in El Paso County, could you get services from a provider in Douglas County? Yes and no. It depends on the kind of Advantage plan you enroll in. And we're going to talk about the types of Advantage plans next, but there are at least 4 or 5 different kinds of Advantage plans. And some of them would allow you to go outside of your county of residence or your network area. Some of them would not. And we'll talk about that in a minute. What is the difference between supplement coverage and Advantage plan coverage? We're getting to that, so give me a minute. I got Part A when I turned 65, but I'm still covered by employee insurance as secondary to Part A. Can I still do the test drive when I get Part B? The answer is yes, because your guarantee issue windows, your initial enrollment periods to this kind of insurance or Medicare supplement doesn't start until your Part B goes into effect. Because again, you have to have both A and B to be eligible to enroll in either of these kinds of coverage. So those timeframes, those enrollment periods do not start until both A and B are in effect. So the answer is yes. All right. So let's talk about how this kind of coverage works. With Medicare Advantage plans, you are going to probably find that you have more out-of-pocket costs. You still have to pay your Part B premium because you have to have A and B. Everybody has to pay their Part B premium no matter what. You may have heard that there are some Advantage plans that may reimburse your Part B premium. As far as I know, there are none available in our area this year. There might be 1 or 2 available in the Denver area, but that's it. And there, even if there are some available in our area, El Paso County area or the Pikes Peak region area, none of them reimburse the full Part B premium. And it is a reimbursement, it's not a payment. You may pay an additional monthly premium to have an Advantage plan. However, many plans are available at no premium. As long as you have Part A and B and you're paying Part B, you can enroll in many Advantage plans that have no extra premium. But you will have other out-of-pocket costs in the form of copays, co-insurances, or deductibles for services. And that's where it's going to vary significantly between supplements and Advantage plans. You will always be able to get any service that Medicare pays for covered through an Advantage plan. It is still considered your Medicare, even though you're not using the red, white, and blue card. The Medicare Advantage plan is your Medicare. So any service that Medicare covers, the Advantage plan must cover also. Again, many of these plans will include Part D prescription drug coverage at no extra cost, but you may be limited to the doctors and providers or the hospital networks you can use. However, if you have a medical emergency, your coverage is good anywhere because it's a medical emergency. But the cost sharing and the benefits can vary from original Medicare. And again, there are multiple kinds of Advantage plans: HMOs, PPOs, fee-for-service plans, special needs plans. If you are interested in getting the most complete look at what plans are available in what areas of Colorado or what counties of Colorado, you can get that information in the Medicare New Handbook. I mentioned the handbook last week. If you call 1-800-MEDICARE to request a Medicare New Handbook specifically for Colorado, in the back of that book, it will list all of the Advantage plans available in the different parts of Colorado, as well as all the Part D plans available in Colorado. If you go online and just look at the PDF version on the Medicare.gov website, it will not be state specific. It will not have that specific information available. There are some other Advantage plans that are lesser known and not always available. For example, Medicare savings accounts, which there are none available in Colorado. Medicare cost plans, which currently are available in Colorado, but are being phased out by Medicare. Demonstration or pilot programs, again, none available in Colorado currently. But Colorado does offer a PACE program for all-inclusive care of the elderly. And primarily that's going to be along the Front Range, the Denver metro area, and the Colorado Springs area. And we'll talk about all of these kinds of plans individually, and I'll try and go through this quickly because I know we're running over time. So HMOs. HMOs, if you have ever been enrolled in an HMO, you probably understand what I'm saying when I say an HMO is an HMO is an HMO. HMOs all work the same way. If you are in an HMO, you have a copay for services, copayment amount set by the plan. In an HMO, you must stay in network, meaning you have to use the providers, facilities, and hospitals that are contracted by that HMO only. If you go outside of that network of contracted providers, facilities, or hospitals, the plan will pay nothing. If the plan pays nothing, Medicare pays nothing because you went out of network. Because you have to stay in network, you are typically going to be required to get a referral to see specialists or to go to some hospitals for some services. You may be required to get prior authorization for some services. Again, you go out of network, you pay out of pocket. Neither the plan nor Medicare will cover any services out of that plan's network, except of course an emergency or urgent need. And HMOs will usually include Part D coverage, no questions asked. Medicare PPO plans are preferred provider organizations, kind of a hybrid of HMOs. In a PPO, you have a network of providers, facilities, and hospitals that plan has contracted with. That is your network. However, in a PPO, you are allowed to go out of network. And as long as you can find a provider who is willing to accept your PPO, their payment and your copayment as payment in full for services, you can go to that out-of-network provider for whatever you need, regardless of where they're at. But that does not mean a provider that you want to see is required to take your PPO. Even though it allows you to go out of network, that doesn't mean the provider is going to want to take you as an out-of-network patient. But because you are allowed to go out of network, they don't require referrals for specialists or other services. They don't require, well, they may require some prior authorization for some services. Again, the copay amount is set by the plan. You're going to pay less in copays to stay in network. You're going to pay more in copays if you go out of network. PPOs may or may not include a Part D benefit. Some PPOs do not include Part D coverage. If you enroll in a PPO that does not include Part D drug coverage, you cannot buy it separately. So you have to have a good reason you don't need it. Medicare private fee-for-service plans. Again, private fee-for-service plans were initially designed to be the most or least restrictive of the Medicare Advantage plans, and basically allowed you to go to any Medicare provider who was willing to accept your private fee-for-service Advantage plan. That Advantage plan did not contract providers or facilities for you to go to, so there was no network. As long as you could find a provider or facility willing to take your insurance, their payment and your co-payment is payment in full, you could go wherever you wanted. So no prior authorizations required, no referrals required, although the plan does set the co-pay amount that you pay, and they determine what they're going to pay the providers. Unfortunately, this kind of plan was being sold in areas where no provider would accept it, in some of the more rural areas. What that means is that made Medicare make a rule. And what that rule was that these plans have to be able to find at least one provider in any county to contract with, so that whoever enrolls in this plan has someone who's willing to take it. Otherwise, again, it's your responsibility to make sure that you go to a provider who's willing to take that coverage as payment in full along with your copay. There is no guarantee that you're going to find that provider. There's no guarantee that that provider is going to want to take you. Even if you can find a provider with a fee-for-service Advantage plan, if they'll take you for one service, that does not guarantee they'll take you for another service. Providers can change their mind on what they'll take on a day-to-day basis with this kind of coverage. Fee-for-service plans may or may not include a prescription drug benefit. However, if your plan does not include a drug benefit, you can purchase a Part D plan separately so that you have drug benefits. Medicare special needs plans are available, again, mostly along the Front Range. Basically, special needs plans are going to be Medicare HMOs, but for very specific populations, such as people who are both Medicare and Medicaid, or for people who are Medicare and live in certain facilities, excuse me, or those who have a qualifying health condition or medical condition. Again, not available in all areas, mostly along the Front Range. Again, that information would be in the Colorado specific Medicare new handbook. Or you can call your local SHIP office or Medicare directly to get more information about what might be available in your area. Cost plans, I'm not even going to talk about really. Anybody currently enrolled in a cost plan has been informed that that plan is probably going away in the next year or so. Basically, an HMO doesn't include drug coverage, very expensive, going away. PACE program, again, is available mostly along the Front Range. The PACE program is basically a Medicare HMO, but it's kind of an HMO on steroids because it provides much more intense management of your health care. And again, it is primarily for a specific population of people who are Medicare and Medicaid, long-term care in the community. So it's designed to help people who are Medicare and Medicaid stay at home, stay in the community versus going to a long-term care facility. It does provide more intense case management and social services and transportation benefits for medical appointments, that kind of stuff. Again, any questions or any additional information people want about these plans, please feel free to reach out to us. And we're happy to talk to you in more detail about any of this. Excuse me. So that's basically Advantage plans and the different types in a nutshell. When you enroll in an Advantage plan, you do have, again, all the same rights and responsibilities that you have in original Medicare. Additional rights you have in an Advantage plan are access to healthcare providers. So that plan has to make sure there are providers available for you to access. especially if that plan limits that access to a network. You have the right to know how these doctors and providers get paid by the plan. You have the right to fair and efficient and timely appeal processes when you disagree with decisions of the plan. You have the right to fast appeals in certain healthcare settings. You have the right, of course, to get the health services that you need, the right to receive any information about the plan and its coverage in easy understand language. And you, of course, have the right to have your personal medical information kept private. Now, let's talk about marketing. I'm going to go back to the person who said they live in Trinidad and was told Humana is their only choice. That is an issue for me, because what that person didn't tell you is that Humana is not the only choice. Humana is the only Advantage plan choice. But they seem to imply, based on your response, that they were the only choice. So they did not give you the full picture and all of the information you needed to make a choice, an informed choice. That is the kind of thing that we are always trying to watch out for when it comes to people who sell this kind of coverage. Unfortunately, and though there are many honest salespeople out there who do this job appropriately and know what they're talking about, there are many people that are not as well educated about this kind of coverage and what they are selling. There are some very specific guidelines as far as what can and cannot be done when it comes to marketing this kind of coverage. I included in the email I sent you a handout that kind of goes through all of this and maybe some additional information about what can and cannot be done when it comes to marketing this kind of coverage. I'm not going to read down the list. It's pretty self-explanatory. If you have experienced any of the cannots, or if you see any of the cannots, or know someone who's experienced any of the cannot situations, I do strongly encourage you to contact us or call 1-800-Medicare and let them know that you encountered or experienced any of those situations so that Medicare can make sure that it doesn't continue to happen. Typically, it is going to be an educational situation of just educating that insurance company or that insurance agent or broker and reminding them what they cannot do. But Medicare needs to know about that. If not Medicare, please call your SHIP office. If not your SHIP office, please call the Division of Insurance and report it. If nobody reports it, people continue to get away with doing inappropriate activities. That's how people end up in coverages that are not appropriate for them. And again, there are lots and lots of things that are cannot as far as marketing goes for this kind of coverage specifically. Again, any questions, concerns, please call us and we're happy to talk about it. There are some things that must be done by these companies. Again, Medicare Advantage plans, they must use all of their marketing material, but that marketing material has to be reviewed and approved by Medicare or CMS. They must comply with do not call registries. They must obtain what's called permission to contact and a scope of appointment. And that more information on both of those are included in the handouts that I emailed for any contact that they have with you. So all of this has to be documented. Any contact you have with an Advantage plan representative has to be documented. Anytime you meet with an Advantage plan representative, they can only talk to you about one product at a time. So if you have an appointment with someone who is talking to you about an Advantage plan, but you find out that they can also sell dental and vision policies, they have to complete the appointment with you about the Advantage plan and then get you to sign a piece of paper before they can start talking to you about another kind of coverage. Very, very, very stringent rules, but those rules unfortunately are in place for a reason, because somewhere, somehow, somebody did not do something appropriately. Again, please call us if you have any questions or concerns. Things to keep in mind if you're looking at Advantage plans or when you're trying to decide which way to go. Specifically for Advantage plans, there are questions I want you to ask. Ask the plan if your specific medications are covered if the plan includes drug coverage. Make sure you have them look up every medication that you use and make sure that it's covered by the plan before you even think about enrolling in a plan. If you have doctors or providers that you want to keep, make sure whether or not those doctors or providers will accept any of the plans that you are considering enrolling in before you enroll in them. If you have preferences of hospital facilities or specific types of providers, make sure that those providers or facilities are covered under that plan or contracted with whatever plan you are looking at getting into. If you doctor a lot or have to see specialists often, do you want to get into a plan that requires you get a referral from your primary care provider every time you have to go to see a specialist? Because now you're looking at potentially 2 separate office visits and 2 separate copays. And then anything else that you think might be important to your specific healthcare needs. You want to make sure that that plan addresses those needs or you ask those questions. Again, in the email I sent earlier, I included an additional couple of handouts specific to Advantage plans. This first handout is a multi-page handout, which kind of pretty much covers everything I just talked about, how the different Advantage plans work, what the differences are, etc. The second handout is a 1-pager front and back. This handout was actually put together by my most wonderful volunteer who took the time and energy to list all of the Advantage plans available in El Paso County. She also did one for Teller County, but unfortunately that's the only 2 counties that we cover right now with this kind of material. But she listed all the Advantage plans available in El Paso County, kind of in a side-by-side at a glance kind of format. So it lists all the plans, tells you what kind of plan it is, tells you whether or not that plan has a premium, whether or not it includes drug coverage, what the deductible might be, what copays might be for the most common services, such as office visits or hospital stays. She even went as far as to tell you what network of hospital the plan accepts or is contracted with, whether it be Penrose or UC Health. Very useful handout. This is for 2021. So again, we also have one for Teller County, but unfortunately that's the only 2 counties that we do this for at this time in our 9-county area. But can be very useful to have, gives you, again, that at a glance information about the individual Advantage plans available in El Paso or Teller counties. And if anybody wants a Teller County one, I'm happy to mail it to you. Just shoot me an email and let me know. Briefly, we're going to talk about Medicare savings programs. Again, these are programs, these are financial assistance programs specifically for people on Medicare, for those who have limited or low incomes, and these programs can assist with the costs of original Medicare. Based on income, gross income per month limits and asset limits, meaning money in the bank kind of asset limits, anybody who falls within these income and asset limits may qualify for assistance on the Part B premium, that $148.50 that comes out of your check every month or will come out of your check every month. This kind of program will pay that for you. At the lowest income and asset level, not only will this program pay that premium for you, it would also pay any deductibles or co-insurances after original Medicare. So basically it would act as a Medicare supplement at no cost to you. If anybody wants any additional information about these programs, we do help with these applications, and we're happy to talk to anybody who wants more information or wants to see if we can assist with an application. And I do apologize, I know we went over, but I do appreciate your patience. That is all I have for tonight, and I will take any questions while I scroll through the last couple of slides. Again, marketing, fraud, abuse, claims. Anytime you have any questions, concerns, or issues with your Medicare insurance, your Medicare claims, marketing issues, anything like that, please give us a call, or you can call the state toll-free hotline for Medicare fraud. Number is listed here. This slide shows our contact information for the local SHIP office for the 9 counties that we serve. Shoot me an email with any questions or concerns. I'm happy to return emails in a timely manner, hopefully, and address any questions that you might have. Well, and I think that's it. So again, I will pause now for any last minute questions. No questions. So all of that was clear as mud. So if I gave you all a quiz right now, you'd be able to pass it. I'm getting some thumbs up. I gotcha. Again, anytime anybody has any additional questions, wants any additional information, please give us a call, shoot me an email. We're always happy to talk to you on a one-on-one basis about your specific situation and how these options affect you and may best suit you. We do have a total of 5 full-time counselors and a part-time volunteer. So we are always available to answer your questions or talk to you one-on-one. And if there are no other questions, again, thank you. Does Senior Insurance have an email? Yes, my email address is listed here. seniorinsure@ppacg.org. That is our general senior insurance mailbox. Oh, no. Actually, yes, it does, I believe. No, Senior Insure with no E. I don't know, I never email myself, sorry. If the E doesn't work, then do it without the E. I'll have to email myself when I'm done here. Dang it, I never noticed that, sorry. Quick question, what plan is most popular? That's a loaded question. If you're talking about Advantage plans, I don't have an answer. There are more and more Advantage plans to choose from every year. So some of these plans available even this year are very, very new to the market. If you're talking about the difference between supplements and Advantage plans, what I can tell you is supplements used to be the thing. It is considered more comprehensive coverage, which is the one of the reasons it is more expensive. But Advantage plans are gaining in popularity, and the more privatized Advantage plans get, the more benefits that Medicare encourages them to offer, and the more popular they become. So that population of people who choose Advantage plans over supplements is growing. Whether it's considered as comprehensive of coverage, I'm not going to say that is the case. But Advantage plans do come with lots of bells and whistles. If you've watched any TV in the last year or two, there are certainly plenty of commercials on TV that are touting all the new bells and whistles that these plans can offer. Although many of these plans that offer some of these more fantastical bells and whistles, what they don't tell you is that those bells and whistles may be available only to certain categories of beneficiary. But, you know, if that's what you're looking for in coverage, just be sure to ask lots of questions and understand how that plan offers those benefits and how they would be offered to you and how you would access them. All right. Again, thank you for attending tonight. We really appreciate it. Hopefully I will see you all next week for part 3 when we talk about Medicare Part D drug coverage. Keep an eye out for an email before the presentation for your slides and handouts. Otherwise, I hope you all have a good evening and a great rest of your week, and I hope to see you next week.